Hi, I'm Raghu Ram. I'm the Vice President for Health Plan Partnerships and Value-Based Care at Roswell Park. We manage the relationships with our health plan partners in the community, both local health plans like the Blue Cross Blue Shield and independent health plans, as well as national health plans. Basically, an individual gets their health insurance program either individually or through their company, and by doing that, they have a way of paying for the healthcare services they might need in the future. This allows you to have a definite amount that you're paying, and if you have more or less costs with the health services that you need, it'll be covered. So usually on an annual basis, sometimes more frequently, an individual will be able to decide whether they want to keep the same health insurance plan that they have currently, or if they are able to change their health insurance plan and pick a different plan that might suit them and their family more appropriately. It varies for different people, but usually it's in the fall or just before the new year starts. The deductible is the amount of money that you have to pay out of your own pocket before the insurance plan will start paying for services that you're receiving. And that's usually on an annual basis, the deductible. As you receive services, some of the services that you receive will ask for you to contribute a small portion to it. And that's usually $10, $15, $20 as an additional payment by you on top of the insurance premium you've already paid. Depending on your insurance plan design, you may have more or less of a copay, or you may not have a copay. And certain services like primary care services sometimes don't have a copay, and preventative services like going for your annual mammogram would not have a copay. You can cancel your insurance, but then you wouldn't have coverage because it'll be hard to obtain another health insurance plan during the time that you need it for the remainder of a calendar year. Usually there can be some important events in your life, such as a change in a job or a marriage, a new baby being born into your family. Those might give you an opportunity to adjust your health insurance plan. Coinsurance is an amount that you would have to pay in addition to the amount that the insurance plan would pay for a particular service. So it's a little bit of a variant on what co-pay would be, but you pay a certain amount and the insurance plan pays a certain amount towards the cost of the service that you're receiving. Medicare is the government insurance that you get as you get into your senior years, usually above 62 or 65 years of age. So you can get a replacement for Medicare that would be called a Medicare Advantage plan, and that would usually be given by a private health insurance plan, and it replaces the government insurance with this Medicare Advantage plan. But it's still governed by some of the rules that Medicare has set for those health plans. In general, Medicare Advantage plans, because they replace the Medicare plan from the government, is a little bit less cost for you, so you may not have as much of a premium to pay for it. The disadvantages are that you're under a little bit more restrictions based on the private health insurance plan that's managing that Medicare Advantage plan. You may not have the full access to all the providers. That's why it's very important to know what the network is consistent of when you're picking a Medicare Advantage plan. Well, everybody has a different situation in their personal lives that would make one choice better than another. In general, a Medicare Advantage plan kind of is more of a comprehensive plan. Often will allow you to pick both drug coverage as well as medical services. So the Medigap coverage allows for an additional insurance coverage for 20% of the Medicare cost that traditional Medicare would not cover. Well, I think the most important thing is you want to make sure that all your personal doctors are participating in the health plan that you're choosing to have for you and your family. And you want to make sure that in case of the need for more comprehensive care, such as from a comprehensive cancer center with a diagnosis of cancer, that you'll be able to go there and be treated and cared for in the most effective way that we have in the U.S. That's why it's important to know ahead of time that your insurance plan covers you so that you are able to be cared for at a special center like a cancer center. After the fact, it's much more challenging, but you do have the opportunity to work with your primary care physician and your specialty physicians and request that an out-of-network approval for care at a cancer center is granted to you. Because cancer and other serious illnesses can't be predicted, it's very important as you choose your health plan, you make sure that the care that you might need is available to you. So if you know of great hospitals and services in the physicians in the community, make sure they're included in your health plan. Supplemental insurance is similar to what's called Medigap insurance. It basically covers the part of the care that you aren't covered for with your basic insurance plan. If you're not covered by the available health plan with a comprehensive cancer center or other important hospital or physicians in your community, it may be good to inquire whether you can expand that coverage with a rider or some other options to allow you to have that coverage. Inquire, especially if it's your employer that's designing the health plan that you get, to let them know that it's important that you have a place such as Roswell Park available to you in case you or your family would ever need it. Make sure you know if there is a special network that you're going to have access to, or whether you'll be able to see any doctor in any hospital. Even as a young person, you're vulnerable, and as you age, you become more vulnerable to health concerns. So it's important to plan and make sure that the health insurance coverage that you have will adequately care for you and your loved ones in case you need. Hopefully you never do, but the assurance that you do is very important, and a little bit of additional cost for your health insurance to make sure that's available is a good idea.